The data actually has demonstrated that minorities, especially African Americans, have a disproportionate burden of the COVID-19 virus.
Dr. Charles Maudlin is a Cleveland Clinic urologist and director of the Minority Men's Health Center.
With further study, we've determined that a lot of it is due to the higher rate of health disparities, chronic diseases, chronic pre-existing conditions experienced especially by African American populations and other minorities.
Conditions including hypertension, diabetes, and higher rates of a variety of cancers.
All of these things collectively contribute to a lower immune system that many African Americans and other minorities have, which then predispose us to not only the COVID-19 virus, but other infectious conditions such as influenza. And so that's why we're seeing a higher rate of African Americans not only acquiring COVID-19, but also a higher rate of morbidity and mortality from COVID-19. We're still collecting data to really realize what the overall statistics are, but it is alarming. It's something that healthcare providers need to be aware of.
Social distancing,
eating better, exercising, getting more sleep,
and visiting a primary care provider for health checks
will all make a difference.
At Cleveland Clinic, we actually produced a video and an audio public service announcement. A group of Black doctors came together to produce this public service announcement so we could better, hopefully better, educate and engage African Americans around the importance of these mitigation strategies.
Mask wearing being one of the strategies.
If you are exposed to a COVID carrier, a COVID-19 carrier, then you yourself have about a 70% probability of acquiring the COVID-19 virus. If the COVID-19 carrier is actually wearing a mask and you are not, your risk goes down to 5%. But if you are both wearing a mask, your risk of acquiring the COVID virus is only about 1.5%. For the most part, patients are understanding about the importance of wearing masks, but there are some instances where some individuals, especially many African American males, are a little reluctant to wear a face covering in public out of fear of discrimination, stereotyping. Oftentimes, wearing a mask or a hoodie in public, for an African American male especially, is associated with racial profiling, and we've seen, unfortunately, what has happened, in the nation recently. It was actually determined that race and racism is a public health crisis, which itself can lead to chronic disease, higher rates of hypertension, and other conditions.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.